So this test is the Thomas test, and it's possibly one of my favourite tests. I like to use it as a stretch as well sometimes because I find it very, very useful. This test will give you a lot of information about length of the quadriceps, the iliotibial band, and little things that are going on with the hip as well. So I'm going to take you through the test and we'll see what we see with Paul here. Okay, so if you sit right on the very edge of the couch for me, a bit further if you can. And if you hold your left knee into your chest, okay, and then I just want you to gently rock back for me. Okay, there we go. And then let that leg relax down as far as it will go. Is that as far as it will go?
Yeah.
Okay. So the things we're looking at here is the angle from here to here. So if Paul's hip flexors were very tight, the knee would be raised up higher. So they're pretty tight because it's slightly off a straight line there, I think. If I let you let go of this leg a minute, you might be able to drop that down. So what I'd be looking for is something more like that, so it's nice and relaxed in this angle. Okay, if you want to take your leg back. The other one we can look at is the angle here, so from the knee to the foot. So the further the leg is this way, the tighter the quadriceps are. And again, you'd be looking for at least 90, but even further back if the quads weren't tight. So you can see there's a little bit of tightness here, not too bad. So the other thing we can tell from here is whether there is a problem going on with the hip, whether there's internal or external rotation, because you will see a rotation through the lower leg. So you might see that it's rotated this way, which would give external rotation at the hip, or internal rotation, you might see the leg coming this way. The other thing that's quite interesting is where the leg lies. So you would hope it to be nice and straight from the hip to the knee. But again, the further it goes this way, it indicates that you've got some tightness going through the iliotibial band this side. So as I said, there's lots of information from this test, and it really is a useful one to use.